Brain SPECT studies were initially used in the late 1960s and early to mid-1970s. CT and the more sophisticated MRI anatomical studies replaced SPECT studies in the late 1970s and 1980s. At the time, the resolution, image clarity, of those studies was superior to SPECT for seeing tumors, cysts, and blood clots. Yet, despite their clarity, CT scans and MRIs could offer images of only a static brain and its anatomy. They gave no information about the activity of a working brain. In the last decade, it has become increasingly recognized that many neurological and psychiatric disorders are not disorders of the brain's anatomy, but are problems of brain function. Two technological advancements have once again encouraged the use of SPECT studies. The early SPECT cameras were called single-headed cameras because they used only one imaging device and took as long as 1 hour to rotate around a person's brain. People had trouble holding still for that long. The images were fuzzy and hard to read, earning nuclear medicine the nickname unclear medicine. And they did not give much information about the activity levels of the deep brain structures. Then multi-headed cameras were developed with special filters that imaged the brain faster with enhanced resolution. Advancements in computer technology allowed for improved data acquisition. The brain SPECT studies of today, with their markedly improved resolution, can see deeper into the inner workings of the brain with far greater clarity. We typically do 2 scans when we evaluate a patient's brain. We do a baseline scan, during which the patient is asked to let his mind wander, and a concentration scan, during which we challenge the brain with a computerized test that measures attention span and impulse control. We have found it most helpful to have both scans to see how the brain activates with or without concentration, and to have a baseline scan for comparison. We look for 3 things when we evaluate a SPECT study: areas of the brain that work well, areas of the brain that work too hard, and areas of the brain that do not work hard enough. It's important to note that everyone's brain looks different. Brains are like faces, and there is variation among them. From an aesthetic standpoint, on scans, some brains are beautiful, while others are a bit misshapen and funny-looking. Beautiful or not, from looking at more than 17,000 brain SPECT studies, it is clear to us that a healthy brain shows good, full, even, symmetrical activity. A healthy brain has all of its major parts intact, and they work together in a relatively harmonious fashion. While there are normal age variations, the brain scans of children and teenagers reveal more activity than the brain scans of adults. Even an elderly brain, if properly cared for during life, looks full, symmetrical, and healthy. When we first started studying anxiety and depression, we thought we would discover evidence of brain patterns that would clearly define the 2 illnesses. We thought we would see signature patterns for each illness. We were wrong. There was not one brain pattern for anxiety and one for depression. There were many different patterns. Of course, once we thought through the problem, it was foolish to think that one pattern would fit all people with depression or anxiety. After all, everyone who is anxious or depressed does not respond to the same medication or the same form of psychotherapy. As we studied the different patterns, we made some other exciting discoveries. We noticed that certain brain patterns responded to specific treatments, while other brain patterns were made worse by traditional treatments. We started to use the scan information like radar to guide us in our treatment choices, and in doing so, we saw our patients improve from the more precise treatment. Over time, we grouped the patterns for anxiety and depression into 7 different categories and developed treatment protocols for each one. The brain systems that underlie anxiety and depression. The brain is the organ that ultimately experiences anxiety and depression because it is the organ of our personality. In fact, the brain controls mood, personality, intelligence, and adaptability. It experiences our hopes and dreams, sorrows and pain. Sometimes the brain is the sole cause of anxiety and depression. Sometimes it is simply the organ that experiences the results of too much life stress. Usually, anxiety and depressive illnesses are the result of a combination of brain vulnerability and life stresses. In order to understand the 7 types of anxiety and depressive illnesses as fully as possible, it is important to understand the underlying brain systems involved in feelings and behavior. The brain is involved in everything you do. The actual physical functioning of your brain heavily influences how well you get along with others, how you think, how you feel, and how you act. When your brain works right, you tend to work right. When your brain doesn't work right, it's very hard for you to be your best self. The brain is the most complex and powerful organ on Earth. It is estimated that the brain contains 100 billion nerve cells, and each of these cells is connected to other cells through hundreds, or in some cases, thousands of individual connections. It is estimated that the brain has more than 1 quadrillion connections within it, more connections than there are stars in the universe. Each part of the brain is vastly interconnected with other parts of the brain. The brain is also very soft, about the consistency of soft butter. It is housed in a very hard skull with many bony ridges, which means it can easily be damaged. The adult human brain weighs about 3 pounds, or about 2% of the body's weight, yet it is the body's major energy consumer, using approximately 20% of the body's energy. Although the brain is complex and interconnected, neuroscientists have learned that certain brain systems are specialized and involved in controlling certain functions. This segment of our audio program gives you a basic understanding of brain anatomy and the latest information on brain function as it applies to anxiety and depression. It is estimated that the brain has more than 2,000 individual structures. To make things more manageable and easier to understand, neuroscientists divide the brain into lobes, or larger systems. The brain is typically divided into cortical, outside surface of the brain, and subcortical, deep brain areas, structures. The cortex is divided into 4 lobes: the frontal lobes, temporal lobes, parietal lobes, and occipital lobes. A useful, broad generalization is that the back half of the brain takes in and perceives the world, while the front half of the brain integrates incoming information with past experience and plans and executes behavior. Through our imaging work, we have seen that there are 5 major systems involved with behavior. As much as we have discovered, it is clear to us that we are only at the very beginning stages of understanding brain function and behavior. The information we present here is based on our own experience and what we have learned through the study and application of what other scientists have discovered. What is thought to be true now is likely to be revised time and time again as neuroscientists continue to learn about the brain. The treatment protocols and diagnostic equipment that we consider state-of-the-art today will seem primitive as technology continues to progress.